Hi, my name is Lacey Turnus. I am a clinical transplant pharmacist who works with transplant patients in the clinic. I am just one of many pharmacists at Froedtert in the Medical College of Wisconsin who works with transplant patients. In fact, pharmacists are an integral part of the team. As you can see, the pharmacists work with you before you receive the transplant, during your hospitalization for the transplant, and also after your transplant. One of the reasons that pharmacists work with you during all these phases of your transplant journey is that medications are an important part of your success. Before the transplant, you will meet with a pharmacist to discuss your current medication routine. Topics for discussion that I would encourage you to be prepared to share with the pharmacist are the following. Number 1, how do you keep track of your medications at home? Some examples may be in a Saturday through Sunday pill organizer or in a specific location in your house where you are reminded by visually seeing them. Phone alarms are another example. How do you keep track of dose changes? For example, if your doctor increases or decreases the dose of one of your medicines, do you keep a log of this information? These questions are important to consider because after the transplant, you will be on 15 to 20 medicines per day with frequent dose changes, especially in the beginning until the transplant team finds the right dose for you. I want to introduce you to some of the most common transplant medications or pills. As I mentioned before, these are also called immunosuppressive medicines or anti-rejection medicines. The reason you take these medicines is so that your own immune system does not attack or reject the newly transplanted organ. Your body's immune system will recognize the new kidney as not belonging to you and want to attack it. The first thing I describe are the names of the medicines. The top is the generic name, and the bottom in bold is considered the brand name of the medicine. I point this out because many times the transplant team uses these names interchangeably. The 3 medicines you start on are tacrolimus, brand name Prograf, mycophenolate, brand name Cellcept, and prednisone. All 3 medicines are available as generic, and most insurance companies prefer that you take the generic form of these medicines. In other words, tacrolimus, mycophenolate, and prednisone. The pictures in the middle just show you the capsule and tablet strengths. It does not mean you will be on all the different capsule or tablet strengths, but rather it is what is available to make up your dose. All 3 medicines are taken to prevent organ rejection. All 3 work at different parts of the immune system, and so I would like you to think of these 3 medicines as teammates. Each one is important in its own way.
All 3 may be a part of your lifelong regimen.
The tacrolimus and mycophenolate you take twice a day, in the morning and the evening. We encourage you to take them 12 hours apart, such as 8 a.m. and 8 p.m. Or another routine might be 9 a.m. and 9 p.m. The idea is to find a time that works best for you and that you can do consistently. There are special instructions listed here. For example, we monitor blood levels of tacrolimus to make sure you are on the right dose. That is what that is referring to. We will explain in more detail once you are transplanted. The side effects are listed. This is not an all-inclusive list, and just because the side effects are listed does not mean you will experience those. A few that I like to highlight are that tacrolimus can affect the health of the kidney. If you are on too high or too low of a dose, your kidney function may decrease. That is one of the main reasons we monitor blood levels of the tacrolimus. We need to make sure you are on the right dose of the medicine. Too little of the tacrolimus in your body can reject the new kidney, and then it does not work as well. Too much of the tacrolimus in your blood can also make the kidney not work as well. Going to the lab and getting your blood work is just as important as taking the medicine because if you're on the wrong dose, it can affect how well the transplant works. Additionally, you may see increases in blood sugar. If you do not have diabetes before transplant, you may develop diabetes or high blood sugar after transplant. If that happens, you may need to start medicines to treat the high blood sugar. The transplant team uses insulin, which are shots, to treat high blood sugar after transplant. If you are already receiving treatment for high blood sugar before transplant, you can expect insulin after the transplant. Other things you may experience are increases in blood pressure or cholesterol. If that happens, we may have to start or continue medicines for those reasons. Mycophenolate can cause diarrhea. If that happens, please talk to the transplant team. Please do not ever stop taking medicines without talking to the transplant team. The side effects listed under prednisone, such as upset stomach, mood changes, and trouble sleeping, are often dose dependent, meaning when you are on higher doses, you may experience these side effects. But over the first few months of the transplant, the prednisone dose is lowered, and often those side effects improve. Although this is a very common transplant medication regimen used by most transplant centers, if you are unable to tolerate these medicines, we can consider alternatives. These just happen to be very good at preventing rejection. Now, because immunosuppressives can decrease your ability to fight off certain infections, we start other medicines to help prevent infections. The names are sulfamethoxyl trimethoprim, often abbreviated on the pill bottle as SMZ-TMP, nystatin, and valganciclovir. Pictures are again there to help demonstrate how the medicines are available. The SMZ-TMP is a tablet, nystatin is a liquid medicine, and valganciclovir is a tablet. The SMZ-TMP, are also commonly called Bactrim, is used to prevent certain lung infections. Nystatin is used to help prevent an infection in your mouth called thrush. And valganciclovir helps prevent viral infections. The duration of the medicines is provided here. Bactrim is often continued for the life of the organ transplant. Nystatin is just while in the hospital after the transplant. And valganciclovir is for 3 to 6 months after the transplant. The transplant team will tell you when you can stop these medicines. Bactrim is taken once a day in the morning. Nystatin 4 times a day is swished and swallowed, and valganciclovir is taken once daily. Special instructions are provided as well as side effects. These medicines overall are well tolerated because they are given at lower doses, since the goal is to prevent an infection rather than treat an infection. Additionally, this slide mentions that not only will you be started on the new transplant medicines, but you may also have to continue on some of your current medicines, such as medicines for blood pressure, diabetes, or cholesterol. We also start other medicines too if needed, such as magnesium pills if you have low blood magnesium levels, or phosphorus supplements if you have low phosphorus in your blood. All things we monitor, inform you of after the transplant. All of this information about the transplant medicines may be overwhelming. However, I want to reassure you that during the transplant hospital stay, you will work with the transplant team to learn the medicines in more detail. A yellow medication card with the names of the medicines, doses, and when to take the medicines will be provided as well. This is an example. The name of the medicine, its strength, and the purpose of each medicine are listed. For example, Prograf, or the generic tacrolimus, is the first medicine on the list. Please be aware that the two medicines' names, Prograf and tacrolimus, may be interchangeably used by the transplant team. This is not meant to confuse you, but unfortunately, sometimes it is confusing, so that is why I'm spending the time to point it out. The medicine you receive is most commonly going to be the generic form, called tacrolimus. It is available in 0.5 milligram, a 1 milligram, and a 5 milligram capsule. It is used to prevent rejection. Next on the list is Cellcept, mycophenolate mofetil, which is available as 250 milligram capsules or a 500 milligram tablet. It's also used to prevent rejection. And lastly, making up your immunosuppressants is prednisone. It's available in many strengths, but the dose that is used for post-kidney transplant is the 5 milligram strength. It is used to prevent rejection. Next on the yellow medication card, I will draw your attention to the section for instructions. This is how you should take the medicine. It's important to pay attention to the dose that you are told to take in relation to the capsule or tablet strength that you were given in your pill bottle. For example, the dose on the yellow card for tacrolimus is 4 milligrams. Based on the capsule strengths available, you would need to take 4 of the 1 milligram capsules to make up that dose. and you need to do this 2 times per day, morning and evening. For mycophenolate, the instructions are to take 1,000 milligrams 2 times per day. You are given 500 milligram tablets. You need to take 2 tablets of 500 milligrams twice per day. Lastly, prednisone. The dose on the yellow card indicates 20 milligrams. You are given a 5 milligram tablet. That means you have to take 4 tablets to reach the 20 milligram dose. I have added as well, if it's helpful, the number of tablets or capsules needed at each spot. Next, we will talk about the times when to take the medicine. An X marks the spot of when to take the medicine, morning and evening, for example, and in this particular case, the patient decided to take the morning medicines at 9 a.m. and the evening medicines at 9 p.m. Additionally, while you are in the hospital, the transplant team's goal is to work with you on reading the label of the pill bottles and making sure you or your support person feel comfortable with the transplant medicines and how to take the correct dose of medicine. Do not hesitate to ask questions at this time. We want you to be successful when you go home, and to do that, it is important to be able to take the correct doses of medicines at the correct time. There are a few more instructions that will be shared with you as well regarding the medicines, but this is a high-level overview. For completeness sake, however, I will add that the tacrolimus requires blood monitoring to make sure you're on the correct dose. It is important that on the mornings you get your blood drawn that you take the medicines, particularly the tacrolimus, after the blood is drawn. A pill box similar to the one pictured here will be provided to you during your hospital stay. This is a Sunday through Saturday pill box with morning, noon, and evening bed slots so you can follow the yellow card and put the medicines in the correct location. It will be really important to keep the yellow medication card up to date with dose changes and so forth, so you make sure you take the correct dose. The yellow medication card instructions are often written in pencil so the doses can be adjusted. As I mentioned earlier, doses can change a lot, especially right after transplant, and so it is important to have an organized system to take your medicines consistently and as directed. Even setting phone alarms at specific times and having them repeat consistently is another tool patients find helpful to remember to take their medicines. Once you leave the hospital, you will follow up with the transplant team. As part of those visits, you will meet with a transplant pharmacist. It is important that you bring with you to the visit the pill box filled with your medicines, your yellow card, and if possible, your pill bottles. The pharmacist can review your pill box and help make sure that you're taking the correct dose of medicines. It is understandably a lot of new medicines, and we want to make sure you feel comfortable setting up your medicines and taking the medicines correctly. In summary, immunosuppressive medicines are continued for the life of the organ transplant. Please make sure you take them as instructed. Missed doses can lead to rejection and your kidney not working as well, or not working at all. If you feel like you are experiencing side effects, please contact your transplant nurse coordinator before stopping your medicines. Any concerns about getting your medicines due to the cost, changes in insurance, transportation to the pharmacy, or any other circumstances, please contact your transplant team immediately. Lastly, please do not start any new over-the-counter medicines, herbal pills, or supplements without talking to your transplant team. It is really important that the medicines are reviewed for your safety. Thank you for your attention.